First this morning, let's go to Washington, D.C., where we have breaking news. President Obama expected to change course on his requirements about health care coverage for contraception. Louise Radnofsky joins us now. Louise, outline what the president is expected to do, I think, any moment right now.
Right. Well, according to what we've heard from senior administration officials today, he's found a compromise that appears to be meeting the concerns of both the religious groups who are concerned about employers who would have to pay for contraception that violates their religious beliefs, and also the women's groups that were absolutely determined that whatever happened, women would still be able to access birth control without paying a copay or a deductible. And the compromise that they've reached is basically this. For the religious employers, for example, a Catholic hospital or a university that decides that it doesn't want to make this part of their plan, they don't have to cover it, they don't have to pay for it. The insurance company instead will pick it up, and they will also contact the employee directly and let them know how it's going to be covered. This was a really key point, because what the Catholic organizations were saying is that they would feel as if they were somehow complicit, even if they gave people directions in how to access contraception. So the insurance company is doing the stuff that the Catholic employers don't want to do, and it seems to be a compromise that everybody may be able to come around to.
So it seems like almost a very sort of subtle shift, and yet a very important one, in that the insurance companies, if I'm hearing you correctly, will be the ones required to provide the free contraception, but the employers who don't wish to do so, they won't have to do it, and they also won't have to sort of act as a go-between for the employee. Is that correct?
That's it, exactly.
And are you getting a sense out there, what's the early read, if you're reading the tea leaves, on whether this plan is going to be amenable to all sides?
Well, we know that the president has spoken directly with Archbishop Dolan, head of the U.S. Conference of Catholic Bishops, this morning. He's also spoken with Sister Carol Keane of the Catholic Health Association, the main hospitals group, and with Cecile Richards of Planned Parenthood. And so far, what we've heard from the latter two of those people is they're both keen on where this is headed. Cecile Richards is in her capacity as head of Planned Parenthood, as you may have noticed in the last few weeks, has a tremendous capacity to raise women's activists to really get mobilized very, very quickly. Right. And she said that this compromise is acceptable to her. She says it preserves the access to contraception that they're primarily concerned with. And
of course, you're referring to the uproar over the Susan B. Komen situation when you refer to Planned Parenthood. Looking at this, back at this situation with the contraception coverage, Louise, there has been a similar plan, I believe, in place in Hawaii. Is that correct? And how has that worked out?
Well, the Hawaii situation is actually a little bit different. We've been hearing talk for the last few days that was where the administration was headed, and they've sort of gone off in a slightly different direction that doesn't really match any of the state plans, because of course this is a federal mandate and it applies just in ways that are different to the states. But what Hawaii does, and it's certainly been one of the models that the administration has been bearing in mind, is, again, it has this situation where the insurance company steps in on behalf of a religious employer that doesn't want to provide this and does it for them.
It's sort of a buffer to the controversy that was going on around this contraception issue. President Obama employed his Vice President, Joe Biden, who I believe is a practicing Catholic, to sort of serve as the emissary here. Do you think that was helpful?
Well, there are a number of Catholics in the administration and non-Catholics who are also concerned about this issue, who'd weighed in. And as we understand it, there seems to have been some divisions from the beginning on which way to proceed. The controversy has been brewing for 3 weeks now. The administration is saying that they always intended to find a way out of this. That's not entirely clear, but certainly what they do appear today to have reached is a solution that they hope presumably will tamp down on the controversy, because in an election year, it really hasn't been very good for them.
All right, very good. Louise Radnofsky in Washington, D.C. We'll continue to follow this developing story with you and the whole D.C. team. Thanks for being here on Lunch Break.